Every day in North Carolina, 11 people die from an overdose. And following the pandemic, the crisis has only worsened. Recognizing the signs of opioid overdose can save a life, here are some things to look out for. Small constricted pinpoint pupils, the person falling asleep or losing consciousness, slow, weak or no breathing, choking or gurgling sounds, a limp body, cold or clammy skin, and discoloration, especially in lips and nails. The CDC says there are 5 things you should do if you suspect an overdose. First, call 911 immediately. Second, administer naloxone if you have it on hand. Third, try to keep the person awake and breathing. Fourth, lay the person on their side to prevent choking. And lastly, stay with the person until emergency assistance arrives. North Carolina has a Good Samaritan law. It protects the caller and overdose victim from prosecution for possession of small amounts of drugs, possession of drug paraphernalia, underage possession or consumption of alcohol, and violating parole, post-release, or probation conditions. And anyone who uses naloxone to reverse an overdose is immune from civil and criminal liability in North Carolina, as long as they do it in good faith. Now, you might be shocked to know how often local first responders use Narcan to reverse an overdose. In Guilford County, EMS workers say they need to use it nearly 4 times a day. Chief of Northeast Guilford's Fire Department, Jeff Chrisman, says it's a big problem.
We've had overdoses from one end of our territory to the other, and it's a widespread problem, and it's getting worse, and the drugs are actually getting worse, so the effects are getting worse.
Earlier this year, the FDA approved selling Narcan over the counter without a prescription. That's which allows the nasal spray to be stocked in convenience stores, supermarkets, and vending machines. The reversal medication is simple to administer.
We're going to take this out. And this is how it would disperse into the nose. You're going to press it, and then you're going to push, just like that, into the nostril.
And it's completely safe if someone isn't actually having an overdose and gets administered naloxone. The medication will do no harm. First responders want you to know that even if you think you don't know anyone who uses drugs, it's still good to have Narcan on hand.
A lot of times people don't know that their relative or the person that they're in contact with is doing drugs. And we might get dispatched for a cardiac, where we get there and we have to look for all the signs that show that they've done an opioid overdose, and that's what the Narcan is effective on.
Again, naloxone is now available over the counter at pharmacies, but there are also places you can get it for free, like the Forsyth County Detention Center lobby. Now, its Narcan vending is used more than 300 times a month, the vending machine that is, potentially saving the lives of 300 people over that time. County leaders say the free vending machine has been so successful, they are now considering adding a second location.
I think access is absolutely imperative. And whether that's by a vending machine or some other access method, that's perfectly fine, just so long as we are reducing barriers. In Forsyth County, there are several locations that you can get no-cost naloxone.
People who come to get Narcan do not have to interact with jail staff. There's also information about relevant resources near the machine. County leaders encourage everyone to have Narcan on hand just in case.
We have smoke detectors in our homes, and we don't put smoke detectors in our homes because we want to have a fire, but we want it there in case there is a fire, that we're able to escape and be safe. And it's a harm reduction technique, not unlike naloxone and Narcan.
While we know thousands of naloxone kits have come out of that vending machine, we don't know exactly how many lives they've saved. But back in December, we talked with the Forsyth Regional Opioid and Substance team. They shared an example of just how important it is for the community.
Someone found a person who was determined to be having an overdose just a few blocks down the street from the jail. And they remembered hearing about that machine. And when they called 911, they actually told the 911 operator that they were going to run to the jail and get some Narcan out of that machine. By the time EMS got there, they were awake and they were doing okay. And it was thanks to the Narcan from that machine.
Each kit comes with 2 nasal spray doses of naloxone. If you are in need of a kit, you can access the vending machine for free in the Forsyth County Detention Center's lobby 24 hours a day, 7 days a week. The Guilford County Sheriff's Office is expanding its medication-assisted treatment programs for jail inmates with opioid use disorders. Last year, the Sheriff's Office started offering the treatment to inmates already in a program when they entered the jail. Now they've expanded it to all inmates. So if an inmate is found to have an active opioid use disorder during intake, they will be assessed by a treatment coordinator. And if authorized, they'll join the program and start receiving a medication like methadone to treat their withdrawal symptoms, that is. And North Carolina is getting $1.5 billion in opioid settlement funds over the next several years. Cities and counties will allocate the vast majority of that money to local programs. But the latest spending decisions from the state have some addiction advocacy groups concerned.
Men facing struggles come to live on this Monroe farmland for a second chance at life.
We take guys out of prison, out of recovery, out of homelessness.
Wesley Kazia leads the faith-based nonprofit Ground 40.
And we provide practical and spiritual guidance to get them back on their feet and back out into the community, back in their homes.
Kazia is helping others after overcoming his own struggles.
I was a heroin addict for 10 years, and I tried NA, AA, secular programs. Like I knocked on a lot of different doors, and it wasn't until I heard the gospel of Jesus Christ where I found help and I found freedom from my addiction.
The program focuses on abstinence-based treatment, meaning to get sober, they do not allow medication.
We believe abstinence is the best way. I did try medication in my own journey, Suboxone, the methadone clinic, and it felt like it was making me more dependent.
Ground 40 is one of several abstinence-based treatment programs getting money in North Carolina's state budget this year. In fact, it's getting $750,000 from the Opioid Settlement Fund.
We need more facilities like this one right here.
But other addiction advocates think public dollars should only go to facilities that offer a wide range of treatments.
When we have programs that are abstinence only, they're really limiting the options that an individual, a North Carolinian, a patient has when figuring out how to tackle addiction.
Lee Storrow with the Community Education Group would rather see opioid settlement money go toward evidence-based treatments.
There are plenty of folks who have benefited from an abstinence-only service, right? But I think for programs to explicitly not allow patients to use the gold standard when it comes to ending, tackling substance use is just really problematic when we think about dollars being allocated by the General Assembly to go to this service.
Kazia says his program has helped dozens get sober, but he encourages anyone battling addiction to choose what works best for them.
If you need help, go get help. Like, it doesn't matter. The goal is to preserve your life long enough to find the one who can heal it.
Forsyth County is having a meeting a week from today to hear how you would like them to use their opioid settlement funds. The county is receiving more than $35 million over a period of 18 years. Over the next decade, Guilford County will receive more than $39 million in opioid settlement funds.
We're working with our community of providers, our advocates, the survivors, to build a strategic plan and launch pilot programs to save lives, stop the suffering, reduce the stigma, and address the ongoing impacts of the opioid epidemic.
Over the next year, Guilford County is receiving $181,000 to fund the settlement fund planning process, and $115,000 was used to create an opioid coordinator position at the county health department. The U.S. Drug Enforcement Administration says it seized more than 62 million pills laced with fentanyl so far this year. It's enough fentanyl to cause over 287 million overdoses. But for one father, only one pill and one overdose matters. Tiffany Liu shares his story.
This is on my birthday.
Looking through photos of his son never gets old.
Me and Brandon.
Brandon is Richard Harrison's firstborn.
Me and him on the golf course, he was trying to beat me.
For this father, these memories are so sweet and he would do anything for more.
And this is actually when he was at a recovery center.
Nearly 3 weeks ago,
I got a phone call.
Richard found out Brandon died of a fentanyl overdose. His son bought 2 little blue pills that happened to be counterfeit.
We took one pill. One pill was it. and he never woke up.
According to the U.S. Drug Enforcement Administration, only 2 milligrams of fentanyl can kill. That's comparable to a few grains of salt. The DEA also says 4 out of 10 fake pills contain a potentially deadly dose.
This pill will kill you. He was just a good kid, you know? He was just a good kid, and he didn't deserve to go out like that.
Brandon is one of the most recent deaths, and the Fort Worth Police Department arrested a man named Jacob Lindsay for this case.
These drug dealers do not care. They have no second thoughts about your livelihood, your family.
Richard warns others.
Me and his mom will never get over it, but I do know that he's proud of us, and I do know that he's not suffering anymore, and he's set free.
The fentanyl epidemic leaves a father with one last photo of his son.
And that's the end result.
Well, if you or someone you know is struggling with drug abuse, remember you are not alone, and there are resources out there to help. You can start with the Substance Abuse and Mental Health Services Administration hotline. The number is right here on your screen. It's 1-800-662-4357. Help is available 24 hours a day, 7 days a week, 365 days a year.